Hello, everyone. Understanding your target blood sugar or blood glucose range is key to managing type 2 diabetes safely. This information is your personal guide, but always confirm your targets with your doctor first. While your ideal range is personal, here are the general guidelines recommended by the diabetes organizations. Please note that the measurements here are in millimoles. General blood glucose targets. So, before meals, the normal blood glucose should range between 4 and 7 millimoles. And 2 hours after meals, blood glucose levels should be below 8.5 millimoles. HbA1c, which is the long term average blood glucose test, is around 53 millimoles or 7%. So remember, targets can vary for each person. So always discuss your ideal range with your doctor, diabetes educator, or healthcare team. And also remember, targets can change based on your age, other health conditions, and treatment plan. So discuss your personal goal with your doctor or your diabetes educator or your healthcare team. So the most important thing is knowing exactly what steps to take immediately to stay safe in the event of high blood glucose. What I mean is what to do in the right now moment. So high blood glucose happens, and so here is your quick guide for managing high blood glucose, also known as hyperglycemia, whilst at home. And when it's time to call for help, immediate actions to take if your blood glucose reading is high are: you want to drink fluids. You want to drink plenty of sugar free fluids, for example, water or plain tea. In fact, you want to stay hydrated. Dehydration makes high sugar worse. Then you want to check your plan. So, if you are not sick, follow the instructions your diabetes healthcare team gave you for correcting high blood glucose. For example, taking an insulin correction dose. If you use an insulin pump, you want to enter the reading and accept the correction dose. If you use injections, follow your personal dosing card for correction doses. So, when to check for ketones? If your blood glucose is above 15 millimoles and you are sick or cannot keep fluids down, you must test for ketones immediately. If ketones are present, seek emergency help and check your blood glucose again in 2 hours. Note your levels and try to figure out why the reading was high. For example, missed medicines, unusual meal, or unusual alcohol consumptions. So, when to contact your doctor or your healthcare team? So, you want to contact your doctor or your medical or your diabetes healthcare team if your blood glucose is persistently above 15 millimoles, even after taking your medications. You are having symptoms like nausea, vomiting, abdominal pain, or dizziness. You are finding it hard to keep your blood glucose in the target range for several days. You have a fever that lasts for more than 24 hours. So, when do you call for emergency help? So, you want to call for emergency help immediately when these signs, for these signs that I'll be mentioning, these signs may indicate diabetes ketoacidosis, which we refer to as DKA, or hyperosmolar hyperglycemic state, which are emergencies. You are sick, you cannot keep food or fluids down, your blood glucose is persistently above 15 millimoles, and you have ketones. You have symptoms like drowsiness, difficulty breathing, or fruity breath odor and or confusion. For long term management, to prevent high blood glucose in the future, focus on these habits. You want to identify triggers. Keep a record of your high readings to spot causes like stress, illness, or changes in your routine. Lifestyle changes, for example, gentle or regular exercise and a healthy diet, help your body use insulin better. You want to manage stress. Stress is a major trigger for high blood glucose. So find ways to relax and consult your team. If your blood glucose is consistently high, work with your team to safely adjust your medications. You are doing a great job managing your health, and always reach out to your team when you are unsure. See you later.